So the applied anatomy is acute and chronic sinusitis. If it is for a short period, acute sinusitis. If it is over a period of long time, so then you call it as chronic sinusitis. In chronic sinusitis, what can happen? So the lining epithelium here within the sinuses. So that I'll use a different color. The lining epithelium can get thickened, and sometimes what happens, the collection within the sinus, so it can be converted into a bag of mucus, so it can be called as mucocele, or sometimes it can be even converted into a bag of pus. So if the lining epithelium gets thickened, so sometimes what happens, it projects into the lateral wall of the nose as a bulge, so that will be called as polyp. So frequently we see the polyp formation in relation with maxillary air sinus, so that you will be learning in your future classes. So that is about the another important aspect of chronic sinusitis. So the applied anatomy is sinusitis. So wherever you can see the collection of this mucus, which will be converted into a bag of pus later, if you have any important structures in the vicinity. For example, if you take up the sphenoidal air sinus, so just adjacent to the sphenoidal air sinus, there is cavernous sinus. So there is pituitary gland, there is optic nerve, and there is internal carotid artery. Whenever there is any infection, so the infection, if it is left untreated in the sphenoidal sinus, so what happens, the infection can spread into the pituitary gland, it can spread into the cavernous sinus, causing cavernous sinus thrombosis. It can even spread to the vessels or compress over the nerve. So these are some of the complications. So if you see any important structure adjacent to it. So now here, so frontal air sinus, so frontal sinusitis, so ethmoidal sinus, ethmoidal sinusitis. So because this ethmoidal air sinus, it is located between the medial wall of the orbit as well as the lateral wall of the nose. So the inflammation can even spread to the orbit, resulting in orbital cellulitis. Now here, any dental infection can cause maxillary sinusitis. This you have to keep in mind. So one of the important reasons for maxillary sinus to get infected. So any nasal infections, if it is left untreated, so that can result in this sinusitis. So this has to be treated at the earliest. So we should not leave the acute to go into a chronic state. So better to treat when it is acute only. So this you have to keep in mind. That's all about the sinus, paranasal air sinuses. One important point what I have left behind is, so I have forgotten, is sphenoidal air sinus. So I didn't talk about the nerve supply, blood supply. So this is again posterior ethmoidal nerve and the vessels, so which will be seen in the orbit. So they'll be supplying the sphenoidal air sinus. And coming to the lymphatic drainage of sphenoidal air sinus, it goes to the retropharyngeal group of lymph nodes. Retropharyngeal group of lymph nodes. So frontal air sinus, supraorbital nerve and vessels, submandibular lymph nodes. So coming to the ethmoidal air sinus again, so this will go to the the nerve supply and blood supply will come from anterior ethmoidal nerve and vessels, submandibular lymph nodes. So here sphenoidal air sinus, so posterior ethmoidal nerve and vessels, so retropharyngeal group of lymph nodes. Coming to the maxillary, here coming to the maxillary air sinus, so the anterior and posterior, sometimes if middle is there, middle, superior alveolar nerve and vessels. So they'll be supplying the maxillary air sinus, and the lymphatic drainage will be again to the submandibular group of lymph nodes. So that's all about the paranasal air sinus.